The scenic view of the counties of Embu, Tharaka Nithi, Meru and Nyandarua present a picture of some of the most fascinating sites found in the vast Mount Kenya region. But along with the many opportunities known, there are challenges that the communities living here encounter on a daily basis, and they have to tackle them head-on. These challenges include HIV and TB as a persistent human health concern. The end of the month of March 2022 marked the completion of the fourth quarter of the USAID Jamii Tekelezi program implementation that is geared towards assisting the communities in addressing issues around HIV prevention, care and treatment services, with the ultimate goal of achieving HIV epidemic control within Cluster 4 counties.
The USAID Jamii Tekelezi program is an integrated HIV prevention, treatment and social services program that is implementing in Embu, Meru, Nyandarua and Tharaka Nithi counties. As Jamii Tekelezi, one of our biggest milestones in the implementation of our program is really an aspect of health system strengthening that is working towards county localization through strengthening the health information management system, HMIS, through the electronic medical records in the 4 counties, as well as the introduction of the county mentorship model.
The collaboration is very helpful to the county. This collaboration I'm talking about is what we are calling the county mentorship model, whereby our partner, Jamii Tekelezi, is providing skills in mentorship to our sub-county teams so that they're able to provide the quality care. This care is done through mentorship, whereby the sub-county teams are capacity built and supported to mentor the service provider.
A few months ago, this is how we used to document our patients' information, but since Jamii Tekelezi program came in, all this information has been documented in the system.
From the outset, USAID Jamii Tekelezi program has been keen to ensure continuity in the provision of quality services to the clients and beneficiaries. For that reason, UJTP has adopted some key implementation models and strategies. In Embu County, the program has embarked on implementation of multi-month dispensing of antiretroviral drugs at the supported facility.
USAID Jamii Tekelezi has been supporting this initiative, and it has been a big win for us, especially for me as a clinician. We have reduced the congestion at our clinics and even at the facility. Even we have reduced the cost of travel by our patients who used to come for monthly refill. Now the ones who are suppressed are coming for the refill after 3 to 6 months.
Mimi napatanga ndawa zangu hapa Isiara Hospital, na siku hizi napeangwa ndawa ya miezi 3 hadi 6, ambayo pande yangu naona inanisaidia sana, kwa inanipea time mingi ya kukaa na familia yangu, kufanya kazi zangu, na kuwa hata wakati nataka kutembea naweza tembea sababu niko na muda mrefu.
In Meru County, UJTP has supported numerous game-changing strategies like the community ART distribution as a strategy to ensure continuity of treatment among the recipients of ART care and treatment services.
The PRs come pick the drugs. We teach them on how to dispense the drugs. They usually meet in the community, and it has really assisted even the PR to accept themselves.
Mimi pia ndio keta na kunywa madawa hapa, na kuna grupu tuliform hapa inaitwa Blessings Support Group. Iko na faida sana.
Vile tunakaa adherence tunapeana kwa hiyo kikundi yetu, na tunafuatilia sana, tunafuatilia mtu akikosekana, tunamfuatilia, tunaona vile anaendelea kunywa madawa zake.
Hiyo ndawa inakuwa packed, hao members wote inakuwa packed na yuko kwa box, napatiwa fare, alafu naenda na bonda na wapelekea huko, na kuna makaratasi yale forms tunayasa. Tunasema mtu amefikia ndawa kulingana na namba yake.
This model has led to improved treatment outcomes and the socioeconomic well-being of the clients. In Tharaka Nithi, UJTP has sustained the use of point-of-care (POC) electronic medical records as a clinical dispensing and appointment-keeping tool that promptly alerts service providers about clients who fail to honor their clinical or drug refill appointments.
In conjunction with the county government and the USAID Jamii Tekelezi, we are privileged to have our return to care clients come back in large numbers in support of the Kenya EMR. When the client comes, the first person who receives this client is the peer educator at the waiting bay. The documents are updated, this appointment diary and the default tracing register. They are updated, and then the contacts for these clients are taken each and every visit the client comes, so that if they has changed the phone or the client has changed the residence, we can just trace this client easily.
The critical role is played by the peer counselors and the support groups in enhancing the continuity of treatment. The care and support for orphans and vulnerable children oversee that transformation made to their health, and the path open for the children will surely enable them to achieve their full potential.
Our work being at the community level, ours is now to make a follow-up, ensure that once the caregiver or the children are given drugs at the facility, that is the ARVs, we make a follow-up together with the caseworkers, and we ensure that every household is attached to a specific caseworker who is going now to follow up to ensure that the children are adhering to drugs, and remind the caregivers even to go for viral load tests.
In Nyandarua County, the program takes pride in the use of EHTS module in the Kenya Electronic Medical Record System, which has greatly impacted on enhancing the linkage of newly diagnosed HIV clients to ART services and strengthening the client's appointment keeping and adherence to ART.
When we get a patient in the hospital, we take them through the eligibility screening, and if the patient is eligible for a test, they get to the HTS room where we feed their data in the EHTS. We use our tablets, and in the case where the patient is positive, we take the patient to the CCC where we link the patient with the database.
For effectiveness, we are able to run a weekly report using the weekly report search. With that report, you can be able to see the patient you have lost within that period of 1 week. You are able to see the patients who have returned to treatment within the same week. So it is easy to gauge where you are last month and this month.
Well, it goes without saying that the USAID Jamii Tekelezi program, in collaboration with the counties, has made tremendous progress towards improving the identification of newly HIV-infected individuals, linkage to care and treatment, adherence, and viral suppression that translates to reduced risks of deaths and HIV transmission.
All these have been made possible through the support of the USAID Jamii Tekelezi program, and we are grateful for the support and the mentorship and the services that we are able to offer the community.
Na ya mwisho, hii mradi ya Jamii Tekelezi pia tungetaka iendelee kutusupport na mandawa, sababu wakati tunapewa mandawa ndio imetuwezesha kuwa tunapata ndawa ya muda mrefu. Kwa hivyo tungeomba waendelee namna hiyo.
My predictions about our partnership with the counties, the 4 counties we work as a Jamii Tekelezi program, is that we shall build the health systems that are resilient, that build how the counties are responsive to HIV programming. And one of the key tenets to that is the entrenchment of programming in the county, such that the counties take the lead role in financing, implementation and monitoring of HIV program. And that is really the main dream of USAID as our main funder.